we're the kind of program that really wants to take care of people and take care of patients. That's our prime directive. But we also want folks to have a good learning experience here. I mean, that's really what this is about. This is why we created it, why we created this program, was to educate physicians, to hopefully take care of our community members, and our prime goal is to make doctors who I want to take care of me.
This is a community-based hospital, so it has a smaller feel to it, but it also has the resources of a larger institution. One of the best characteristics of this institution is being affiliated with Campbell University. Campbell is a sponsoring institution for our program.
One of the ways that the administration has shown its support is by putting us a state-of-the-art clinic and having state-of-the-art opportunities in the hospital for rotations. And ever since the residency started, we're hiring more physicians and bringing even more specialties to the area, which I think is really maximizing the residents' education and experience here.
So one thing I've come to really appreciate here at CMC is how tight-knit our community of providers is. So not just in terms of location, although our hospital is right next door to our residency clinic, most of our specialist offices are right on the same campus as well. We have a really collaborative nature between primary care and specialists, between inpatient and outpatient, and that collaboration is great not just for our learning, but also in how we interact with each other.
So I really feel that the teaching faculty at Conway Medical Center is top-notch. We really feel that we have a support from our administration in the hospital to really seek out opportunities really to teach and learn. We really try to make our residents feel like they're as close to attending while they're on each service.
So one of my favorite aspects about CMC, it's getting to work one-on-one with your attending physicians. You're not afraid to make mistakes because you're always under the wing.
Residents communicate with me directly, and medical students communicate with me directly too through my phone, and I don't mind it. You know, some places it's different, but it's not difficult here.
I don't know why I like to teach, but I've always liked to. Because when I was in training, I had fantastic role models, and the people that taught me were spectacular, and I can still remember their names and see their faces here now 40 years since I finished my residency. I felt like I wanted to pass this along to the next generation of physicians, and so far it's been a lot of fun.
Right from the beginning, their focus is on preparing you for the board examination. Strong didactics and curriculum are definitely the highlighting features of our program. You are prepared right from the day one about the practical world and the practice management. I think those really adds value to your education.
It's not just a matter of having the knowledge and passing their board exams to go out and practice. It's really learning all of the different, patient care, communication and interpersonal skills, learning all of the ins and outs of establishing a practice. So it's more than just learning the knowledge. There's a lot more, I think, involved in preparing that resident to go out into practice and be successful.
So we get some really interesting pathologies here at CMC, both in our residency clinic and in the hospital setting. We have definitely your bread and butter cases, but you also have a lot of interesting pathologies coming from both the tourists that are visiting our city, as well as our rural and underserved population. We get a fair amount of people who haven't seen a doctor in 20, 30 years, and so that definitely brings its own challenges.
This is a great patient population. We have an interesting mix of patients, really, from young to old. So we get a really good mix of patients and pathology, a lot of diversity.
One of the underrated things about living in Conway and Myrtle Beach area is really just having the big city amenities while you're still feeling a sense of just a smaller community in each of the neighborhoods around Myrtle Beach.
You've got the small downtown Main Street part of Conway that's kind of your classic southern hometown.
They have the river walk down there.
You've got Myrtle Beach, which is really touristy. We get 18 million visitors a year before COVID.
Baseball games, miniature golf.
Actual golf for those who are talented enough to play that.
There's Myrtle Beach State Park.
Market Commons is a fun place to go out to breweries and shopping.
There's Huntington State Park.
We have Broadway at the beach, which has an amusement park, an aquarium.
And of course my trips to Costco.
So, one of the benefits of practicing medicine or doing residency here at CMC, I think, has to be the people. So you can get residency training anywhere, but because it's such a small community hospital, you kind of really get to know everyone that works around you. Whether that be the CFO that comes by and says hi to you, or if it's the housekeeping staff at the end of every clinic shift, or it's even the people that work in the cafeteria that hand you your lunch. After a few days, they get to know you, they know your name, and you kind of get to know them too. The people here, they've lived their entire lives here. I'm talking generations. Their grandmother, their mother, themselves, they were all born in this hospital. They either work for the hospital system, know someone that works for a hospital system, or is related to someone that works or goes to CMC.
The culture of our hospital is such that it's a very pleasant place to learn and to practice, and I've been here for 40 years, and I don't think that would be true were the circumstances different.
Being serious, CMC is a kind of family atmosphere, and to me that means a lot. Having been here over 20 years, I've seen this place change, but one thing's remained the same is that family experience. We take that very, very seriously. Healthcare is number one, and taking care of patients is number one, but also being part of a family and something bigger than ourselves. That's what I love about this place.